Good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Tuesday, April 7th, 2020. Today we have Toronto Mayor John Tory, Toronto's Medical Officer of Health, Dr. EIleen de Villa, and Toronto Fire Chief and General Manager of the Emergency Operations Centre, or the Office of Emergency Management, Matthew Pegg. Mayor Tory is first. Mr. Mayor.
Well, good afternoon, and I want to start today by acknowledging that today is World Health Day and Caregiver Day. And now more than ever, I think it is important for all of us to acknowledge and recognize the amazing work that our health workers and caregivers are doing across the city during this crisis. They are fighting the COVID-19 pandemic for us. I've said many times that our nurses and our doctors and our paramedics, along with all of our healthcare and public health workers, are on the front lines of this crisis, but they are also the last line of defense that we have to keep us safe and healthy, along with our family members, our friends and neighbors, and our entire city. And that is not meant to leave out to people like the grocery workers and the transit staff and others who are keeping the city going during what is an unprecedented situation. To protect our healthcare workers and our healthcare system, I urge people to continue to follow Dr. de Villa's advice to stay home and to stay away from others in order to avoid the further spreading of the COVID-19 virus. I hope people will be out tonight at 7:30 in the evening to cheer on our healthcare workers, and I thank the residents who've made this a nightly ritual because I think it is recognized and appreciated by those that it is meant to honor. I hope the workers hear the cheers and understand the very deep gratitude that everybody from the mayor through every single citizen of this city feel towards them. Our city employees, including our public health workers, have been working nonstop to respond to the COVID-19 pandemic. Today, I sent a message to all city employees thanking them for their work. As mayor of this great city, I firmly believe that we provide to our citizens the best services of any city in the world. And that is thanks to the thousands of dedicated public servants who work tirelessly each day to ensure that the people of Toronto are safe, that they have the supports and the services they need to reach their potential and to enjoy a good quality of life. There's nothing easy about the work that our staff do day in and day out at the best of times, but they do it with great integrity each and every day. We've asked some employees in this current situation to take on new responsibilities, in some cases far removed from their day-to-day life and from their normal comfort zone. But they're doing so, they've been asked to do so in the service of the people of Toronto. This is a critical time for our city, and the work that our city workers do has never been more important or necessary. Simply put, we need their services now more than ever. I've spoken admiringly in the last few weeks about the heroes who are leading our fight against COVID-19. And I wanted our staff to know that I'm talking especially, not only, but especially about them because they are the family that I have the privilege to lead in the service of our city. Working on the front lines to ensure that Torontonians remain safe, or working to ensure that when the city reopens again, we're able to get back to our best as soon as we possibly can. Our staff are, today, providing the most important work of their lives and of their careers. And I know Torontonians can continue to count on them to deliver the services they need to get through this. Now, here's an example of the good and quick work that our staff is doing, and it's not directly related to healthcare, but it's something that was an important thing that came up in the last number of days, and you could see a quick response and an immediate response by our public servants. We heard from charities with donation bins out across the city that people were illegally dumping things, in some cases donations, so they were well-meaning in some respects, around these bins, which had been closed. They were closed and donations were no longer picked up because the COVID-19 pandemic made it inadvisable for us to leave them open and have people randomly dropping things off. But what did happen was that some thoughtless citizens just couldn't recognize that fact and used these areas as dumping grounds, and for a lot more than donations. There were other things that were left there as well. And so these piles became a mess and they needed to be cleared up. So I asked this morning for this to be fixed right away. Not necessarily the most important thing in the entire city, but something that was causing a lot of people to give us a call and tell us that they really wished, as a matter of safety and health and as a matter of unsightliness, that this should be fixed. So we worked with Solid Waste Management Services and our municipal licensing staff, and I'm very pleased to announce that we have launched a blitz which is well underway today to clean up these areas around these donation bins across the city. So that's an example where every public servant somehow becomes involved in a byproduct of this crisis, because the bins were closed because of COVID-19. That created a problem which then our public servants fixed. Now I think it's the time for residents to help out by not dropping donations at these bins. I admire and I thank you for the fact that you care about your fellow citizens and make these donations, but right now the bins and the city is in no position to see those donations accepted. And in fact, you might argue that they will never end up reaching the people that you're trying to help. So I'd ask that you stop that. It's not good for the environment, and it's not good for getting donations to the people who need help. As for those who took advantage of this situation to leave garbage beside these bins, if you're caught doing this again, if people continue to do this, you will be charged and you'll be fined under the appropriate provisions, and I think that is something that you would richly deserve. So crews will be blitzing bin locations, but residents can help us out a lot. If you see a hotspot of uncollected donations or other things that have been left beside these bins, please call 311 to let us know, and we will take this very excellent staff that has helped us through this blitz beginning today and make sure that they attend to this. Now, beyond the bins, I want to speak to one other matter that has been the subject of quite a few complaints to my office and to 311, which is the matter of people disposing of gloves and masks that they quite properly end up wearing, whether it's to visit the hospital, we've heard quite a bit about that, or even visiting some of the food stores. We've had complaints from outside of both. It's hard to believe, in a way, that people who are really concerned to the point where they put on a mask and gloves, they're concerned enough about contracting or putting out the droplets that can lead to somebody contracting this virus, would be the very same people that would take those gloves and those masks off and throw them down onto the ground, where they pose a potential risk for others. I want to thank the people, quite frankly, who've reached out to my office to complain about this, because while it seems like a small matter, it carries with it potentially a big risk, and it's just the wrong thing to do. It's boneheaded conduct, and frankly, it's littering, even if you leave aside the healthcare aspects of this. So it's a risky behavior. We're asking people to stop it. We're asking them to use the receptacles that are provided outside of hospitals and outside of food stores to look after these kinds of things. And just to remember that at a time when we're trying to save lives, when we're trying to reduce risk, when we're trying to reduce the spread of this virus, this kind of behavior is not only frustrating, it is risky behavior, risky to the health of others. And by the way, the fine for littering, you hate to talk about this kind of stuff all the time, but the fine for littering in Toronto is $500. And I think anyone who continues to do this would richly deserve that and more for doing something that's not only wrong every day, but it's particularly wrong and risky at a time like this when we're confronted with this healthcare crisis. So I know you hear me up here a lot of the days telling people what they can't do and spreading sort of what seems sometimes like bad news. But I want to stress again that the vast majority of people are doing the right thing. I think we really are seeing some progress in the context of people deciding they're going to physically distance themselves, they're going to stay home, they're going to stay away from crowd scenes, they're going to limit their visits to places like parks to an absolute minimum. And I think people are trying to do their very best to save lives and stop the spread of this virus. This is a battle to save lives. Make no mistake about that. We continue to lose people in our city, and we're not losing it because of the conduct of other people, but we could lose fewer people if people behaved and got 100% on board with the program that we've been repeating up here every single day. And it starts, of course, with staying home, and I think it will contribute to this being over sooner, which I think all of us want to happen, that this is over as soon as possible. And so that is going to happen if we stay home, including during Passover, Easter, and Ramadan, all of which are very important events on the spring calendar, which are focused on people getting together, often in large groups, sometimes just in smaller family groups. And I know it's tough, but I think that the people of Toronto have shown over and over again that they know how to get things done, that they know how to band together and collectively exercise the will to overcome any difficulty. And it seems a small sacrifice to ask, just one more I understand, beyond the many that people are making, that you look ahead to these holidays this weekend and decide that you're going to stay with the people you're living with, not visit other family members, not have them visit you, not have people come from out of town, not to go out of town, just to stay home. I know that we can do that together, and I anticipate that we will see results from that, which are about saving lives first and foremost. Thank you. And now it's time to hear from Dr. de Villa.
Thank you, Mayor Tory, and good afternoon, everyone. I'm pleased to share this afternoon that we have partnered with the University of Toronto, who has provided a group of volunteer medical students and 2 staff from the Faculty of Medicine to help with our COVID-19 response at Toronto Public Health. They will begin working with us this week to support our low-risk case and contact tracing efforts, and I would sincerely like to thank the university for their very generous support. In terms of an update on our numbers, as of 12:30 this afternoon, there are 1,449 cases of COVID-19 in Toronto. This includes 1,218 confirmed and 231 probable cases. There are 142 cases hospitalized and 63 in intensive care units. Sadly, there have been a total of 10 new deaths from COVID-19 in Toronto. And again, I would like to express my deepest condolences to the families and friends of all individuals who have died from COVID-19 in our community. I also wanted to share today that I recently learned of a new case of COVID-19 within our shelter community. We are actively collaborating with Seton House to carefully investigate this matter. The client is currently in self-isolation, as is the one other client with whom he shared a room, and my team is actively following up with any other close contacts identified. My team is also working with staff at Seton House to ensure that enhanced infection prevention and control measures and physical distancing measures are in place to protect the residents and the staff at this facility. This includes enhanced cleaning and disinfection to reduce the risk of virus spread, prominently displayed signage on hand washing and infection prevention and control practices, and active screening for symptoms amongst both staff and residents. In addition, Shelter Support and Housing had already taken a number of proactive steps, such as reducing capacity at the site and limiting the use of bunk beds so as to enhance physical distancing, and moving 20 clients today and more anticipated by the end of the week to hotels and other facilities, also to enhance physical distancing and to limit virus spread. Lastly, as the Mayor stated yesterday and as well today, I also want to acknowledge that spring is a time when many of us observe religious and cultural celebrations and holidays. I encourage you to find creative ways to stay connected with family and with faith-based communities without visiting in person. This means things like connecting with loved ones, friends, and other members of your community, either online or by telephone. If you're planning to mark an occasion with a special meal for members of your household, I ask that you please plan ahead and limit your trips for groceries to once per week. I know that we find ourselves in unique and challenging circumstances this year. However, the best way to show our loved ones that we care during these unprecedented times is to do so virtually. We are all affected by COVID-19. We all have to do our part to make a difference in our city. Please stay home, stay safe, and take care of each other. I'll now turn over the microphone to Chief Pegg.
Well, thank you, Dr. de Villa, and good afternoon. I will provide an update on personal protective equipment, an update on yesterday's enforcement activity, and finally an update with respect to additional supports being provided to our most vulnerable residents. As you know, the issue of personal protective equipment continues to be one of the challenges being managed both within our Emergency Operations Center and around the world in response to COVID-19. Late yesterday afternoon, the City of Toronto discovered that we had purchased more than $200,000 worth of surgical masks that do not meet the specifications the city requires for such masks. Immediately, upon becoming aware of this situation, we took action and recalled the masks. 4,000 boxes containing 50 masks per box were received on March 27th and placed into inventory. On March 28th, 1,252 boxes totaling 62,600 masks were distributed to the city's long-term care homes as part of the city's normal personal protective equipment inventory and supply process. After receiving reports of these masks ripping and tearing, a further inspection of the mask determined that the masks ordered did not meet the city standards and specs. The city's occupational health and safety team are engaged, and we are conducting an investigation to determine how many employees may have used these masks and if there was possible exposure to COVID-19 as a result. The masks are being returned, and the vendor has committed to a full refund. The city is now relying on its remaining stock of surgical masks while replacement masks can be purchased. The acquisition of replacement masks will happen on a priority basis. The province of Ontario has been made aware and have been asked to help us expedite this order. The city has also undertaken an additional quality control review of its supply chain process, and all future orders of personal protective equipment will now undergo additional scrutiny and verification in order to ensure the product that we receive meet the specifications ordered. The supply of quality personal protective equipment in a timely manner is a known concern not only in Toronto but around the world. All efforts are being made by all levels of government to ensure the products being shipped and received meet the established standards. With respect to enforcement, our COVID-19 enforcement team, comprised of the City of Toronto, Toronto Public Health, and Toronto Police Services personnel, continue to conduct a number of coordinated enforcement activities. For those who are complying with the orders and bylaws relating to social distancing, thank you. You are making a difference in controlling the spread of COVID-19. Yesterday, we received 55 complaints regarding non-essential businesses that remain open. We have deployed enforcement teams to respond to each of these complaints. Since March 24th, we've issued 34 notices under the Emergency Management and Civil Protection Act. Yesterday, we received 385 complaints about people using closed parks amenities and about a lack of physical distancing in our parks. In response to these complaints, we issued 12 tickets yesterday, bringing the total to 26 since April 4th. We educated 848 people yesterday regarding the use of parks amenities and maintaining appropriate physical distancing. We continue to focus on the parks with the highest number of complaints, which is the same list I provided to you yesterday. Generally speaking, our parks were quieter yesterday than on the weekend. However, we continue to see people participating in prohibited activities in our parks. Examples of these activities include many residents gathering in off-leash dog parks. Please note that all off-leash dog parks are closed, and all dogs must be kept on leash while being exercised. People playing ball hockey, soccer, basketball, and other sports in town parks and squares. These activities do not comply with physical distancing and are prohibited. Playgrounds continue to be used by children. All playgrounds and parks amenities are closed and may not be used. And groups of people continuing to use skateboard parks, which are also closed. I would like to thank everyone who is engaged in the COVID-19 enforcement team for their hard work under difficult circumstances. I would also like to thank Torontonians that are respecting the social distancing requirements. By respecting the bylaws and orders, you are helping to reduce the spread of COVID-19 in our city. Finally, as you know, the City of Toronto has been taking a number of swift and significant steps to help our most vulnerable. To date, we have secured 1,200 hotel rooms in 12 hotels. 313 people have been moved into hotels to date. An additional 15 locations are being considered. 17 people were rehoused last week as part of the Toronto Community Housing Rapid Rehousing Program. An additional 54 units have been client matched, and another 35 units are in the process of being matched. 20 people are being housed in the city-operated COVID-19 isolation site while they await their test results. Our additional 200-bed isolation site, in partnership with the Province of Ontario and our community health partners, is opening tonight. In closing, as always, I encourage everyone to make toronto.ca/COVID-19 your first point of contact for information relating to COVID-19 in Toronto. Thank you.
Thank you, Chief. We'll now go to questions. Reminder, 2 questions. We have a number of reporters today who are online. First is Matt Bingley from Global News. Matt, go ahead.
Chief Pegg, I'm just wondering, in regards to the masks, you said last week that you were having difficulty finding sources that were not fraudulent. So I'm just wondering if you could tell me, when it comes to PPE, how many other shipments that you have had in the past couple of weeks, and if the city is reviewing those now based on this revelation with the masks?
Sure. Thanks, Matt, for the question. You're exactly correct. We know that the issue of fraudulent and, I'll say, poor quality personal protective equipment is an issue around the world. So certainly something that has now affected the City of Toronto, but is affecting all of our colleagues, not only in Ontario and Canada, but globally. I will say that we have been fortunate, if you will. To my knowledge, this is the only shipment of personal protective equipment for which we've had concerns to date. And like I said, Matt, in my remarks, we have already actually escalated and increased our goods receipt process, if you will. And important to note that it's actually sad that we have to take those additional steps. But unfortunately, with the global supply chain being what it is, we just have no choice but to go through the additional work and to add the additional steps to undertake additional physical inspections and additional verifications that under normal circumstances would not be required. But we're doing that on the basis of taking every precaution reasonable and everything available to us to ensure that our supply of personal protective equipment is of high quality, and that was implemented as of last night and will continue.
And Dr. de Villa, I'm just wondering if, while you inspect how many staff members may have been wearing these masks at long-term care homes, have you taken any staff out of circulation or off duty while you test and make sure that they're not spreading this around?
So, Matt, as it turns out, because that's an issue that involves staff, that falls largely within the realm of occupational health and safety. Certainly at Public Health, we're concerned around, infection prevention and control within the context of long-term care homes. But at this moment in time, right now, the efforts are focused on staff, and the lead is our occupational health and safety colleagues. As Public Health, we're here to support, any conditions within the facility with a focus on infection prevention and control.
Okay, we'll go to Chanel Call now from CP24. Go ahead, Chanel. Chanel? Just one sec there. Okay, we'll go to Marika Walshen from the Globe and Mail. Sorry, just give us a moment, folks. We're just having some difficulty with the unmute function here on the WebEx. We'll be right with you. Sorry, I apologize, everybody. We're just having a little bit of a technical challenge with unmuting, so we're fixing that, and please stand by. We'll be right with you. Okay, I apologize. Let's try Austin Delaney from CTV then. Austin, go ahead.
Hi, can you hear me?
Yes, thank you.
Hi, Dr. Good. Dr. and masks are being thrown all over the.
Sorry, Austin, can you repeat that, please? We're having some challenges here this afternoon, clearly, so I apologize. If you could just repeat the question.
That's okay. My question is for Dr. de Villa. Can you talk to me, please, about the risks associated with the face masks and the gloves, the rubber gloves that are just being discarded on the streets?
So yes, as far as I'm concerned, first and foremost, as you heard from Mayor Tory, it is littering. There's no need to be discarding masks or gloves, and I think when we think about the use of personal protective equipment and the appropriate use of personal protective equipment, that entails the appropriate discarding of those pieces of equipment, whether we're talking about masks or gloves. I think the issue is that if those are being used in order to protect oneself from exposure to COVID-19 or other respiratory viruses and agents of infectious disease, there is the possibility that there are viruses or other materials on those gloves, on the masks, and by discarding them appropriately, one runs the risk of exposing others to those disease agents. So I think the important thing here is to use personal protective equipment in the appropriate circumstances, and that includes discarding of those pieces of equipment in an appropriate fashion by putting them in the garbage. The other point that I think bears making at this stage is that if one stays home as much as possible, we are able to preserve the use of personal protective equipment, gloves, masks, and the like, for those circumstances where they're needed the most and where the greatest evidence is for their use. And that's in particular for essential service workers, for first responders, and for healthcare workers who are actually administering care to ill individuals.
A follow-up, Austin? I apologize, ladies and gentlemen. We are a bit technically challenged today. We're working through it. Just please stand by. Okay, Austin, we'll have to come back to you. Jennifer Pagliaro from the Star, are you there?
Hey, yeah, can you hear me?
Yes, go ahead, please.
Okay. I have some questions from Marika since she was next. If you don't mind, I'm going to ask
Yes,
those
please.
and ask
That
my
would be
questions.
wonderful. Thank you.
Okay, so from Marika, and I think this is probably for Chief Pegg or for Dr. de Villa, how many of the long-term care homes that got masks have cases of COVID confirmed?
So I'm afraid I don't have those details. We can certainly get them for you, Jennifer.
Okay, yeah, if you could, if maybe Brad could send those to Marika.
Yep.
And also, Do you know how many days supply of PPE the city currently has with those masks having been recalled?
Hi, Jennifer. It's Chief Pegg. I can tell you that the masks that I spoke about, the substandard masks, if you will, represented about 50% of our surgical mask inventory. So with the loss of those masks, we're estimating right now at the demand levels we've seen at the start of the week, with about a 2 to 3 week supply remaining. I will say, and important to note though, that all other aspects of our personal protective equipment, other forms of masks and our other PPE articles are sitting right now based on current demands at approximately 6 to 8 weeks of supply.
And just my own questions, I'm wondering, you mentioned that you've stepped up the checks of those masks, but I'm wondering what checks were in place when those masks went out? Sure.
So the normal process, as you can appreciate, is what would be customary within any warehouse and inventory supply chain management process. So that's goods received, they're put in inventory, they're tracked, and then they're issued on an
There's something that's just come down for us?
Sorry, on demand basis. The additional checks that we're putting in place really deals with some additional product quality verification through some of our specification engineers. We'll be taking an additional look at the product received, which will physically mean looking at it, doing some specification comparison, all on the incoming or the goods received side, such that we can satisfy ourselves that the incoming PPE is of sufficient quality that meets the city specification.
And just about, again, about PPE, but for shelter workers, I know that there have been additional cases where I'm hearing that shelter workers have been confirmed positive. I don't know if that's been confirmed yet in the city's numbers, but what is the update on whether those workers, including harm reduction workers, will have access to PPE?
So I can start anyways and say that, like I said, our present PPE inventory is stable, notwithstanding the fact that the loss of these defective masks obviously impacts our inventory. But like I said, at present consumption rates across the city, we are resourced with approximately 2 to 3 weeks of PPE inventory based on our current rates.
Okay, thank you. We'll go back to you, Austin, for a follow-up. Apologize. Are you there, Austin?
Yeah, I'm here. Thank you. Again, to Dr. de Villa, I just wanted to be clear, if you could be clear for me, is there a risk of contracting the virus by picking up these gloves, these discarded gloves and masks?
So, Austin, it will depend on whether, in fact, there is viable virus on any of those items. If you pick them up, actually acquire virus on your hands, and then get that virus into your system, either through your eyes, your nose, or your mouth. So there are a lot of steps there that are involved, and that's why we've often reminded people that there are a number of things that are necessary in order to protect oneself appropriately from respiratory viruses, including COVID-19. So first and foremost, discard of your personal protective equipment appropriately so that it doesn't put anybody at risk. Second, we would ask people to stay at home as much as possible so as to, one, not require the use of those kinds of equipment, masks and gloves, and to reduce any risk of exposure. And finally, things like washing one's hands becomes an important aspect to care, right? Any virus that you may pick up on your hands that you pick up from touching those kinds of discarded pieces of equipment can be effectively removed by simply washing one's hands and avoiding touching one's face.
Okay, thank you. We'll go to Mark McAllister next from City News. Mark, go ahead.
Chief Pegg, if you would, just following up on the quality control checks that are now going to be put in place. I think there's going to be questions about what had been in place prior and why they're not at the levels they will now be as a result.
Yeah, thanks, Mark. And I think, like we've talked about before, we can all appreciate the fact that the supply, not only the timely supply, but the supply of quality, high quality, compliant personal protective equipment is something that is being faced and being experienced by all of our colleagues around the world. And as a result, it has become necessary for us to take extra precaution. We've put those extra precautions in place. you know, it's sad. Like I said, it's sad that that the present state of affairs, and that you know, we're seeing a supply chain and a personal protective equipment inventory globally that contains less than adequate or substandard product, but that's our reality today. So hence why we've taken the step of increasing the inventory checks, if you will, and the quality assurance checks. And I should say that is for one reason and one reason only. There is nothing that matters more to us here than the health and safety of our residents and the health and safety of our workers. And that means that if we need to put additional security and additional process controls in place to protect both, we will. That's the decision that we've made, and that's exactly what we've put in place and why we've put it in place.
And as a follow-up to that, you had mentioned the amount of supply that still exists despite the recall. There is a reference, however, to the fact that some of this is coming from a stockpile.
Mm-hmm.
Why is there a stockpile when we've been talking about a shortage for some time?
Sure. So it's really just the use of terms. The stockpile simply refers to the inventory that the City of Toronto maintains on hand. As you know, and as we've talked about in the past, we have been proactively managing personal protective equipment since before the arrival of the first COVID-19 case in Canada. We continue to do that, and as a result, we've been as proactive as has been possible in acquiring and protecting and managing the supply of personal protective equipment we need in our city. Those operations continue, and the use of the term stockpile really is only in reference to the existing inventory we have within the city for supply of not only our first responders, but all of our frontline workers as required.
Okay, thank you. We'll go to Camille Caramali from Global News. Camille, go ahead.
Hey, can you hear me okay?
Yes, sir. Thank you.
Hi, Mayor Tory, you had mentioned that you've seen anecdotal evidence that grocery shoppers are not following the physical distancing rules in grocery stores. Can you tell us a little bit about your observations and what your concerns are leading up to the Easter long weekend regarding that?
What I actually said was that the grocery stores themselves had brought to our attention that there were people inside those stores who were not following the one-way lanes that had been set up, were not following the tape that were meant to keep people separate from one another, were getting too close to the staff that were trying to stock the shelves and whatnot, and it was the grocery stores themselves that brought this to our attention and asked that minority of people who are either unconscious of or are not following the very clear directions that in most stores have been established by the store owners should do so, and should do that because it is going to keep everybody safe, it is going to stop the spread of this disease, and ultimately save lives, not to mention that it'll make shopping a better and more healthy experience for all the people who are doing it, including the staff.
The follow-up is a sort of a different question, and this might be for Chief Pegg, but are there any other orders with the vendor that the masks came from?
So what I can say is that we've only received one shipment of masks from this particular vendor, and like you heard in my remarks, they've all been recalled, they're all being returned, and the vendor has committed to provide the city with a full refund.
Okay, thank you, Camille. Next, we go to Francine Copeland from the Toronto Star. Francine, go ahead.
Good afternoon. Chief Pegg, where were the masks from?
These masks were manufactured in China.
And a follow-up question, how bad were they? I mean, how likely is it that workers who wore them and dealt with COVID-19 patients would be infected, or that patients would be infected by someone who was treating them? I mean, how likely do you think it was that people were infected as a result of the failure of these masks?
Well, I'll start, and I may defer the likelihood questions to Dr. de Villa. All of the conversations I've had and what's come to my attention with respect to the masks is that immediately upon removing them from the packaging and attempting to what we call don or to put on the masks, they were suffering a premature failure. So they were commonly described to as ripping and tearing. So that's the circumstance that gave rise to the concern that those concerns were in short order forwarded and brought into the Emergency Operations Center, and that's what we responded to overnight by recalling them and replacing them with other inventory. So Certainly not my expertise to talk about probabilities. Maybe Dr. de Villa.
So, Francine, what I can offer at this stage is that because my colleagues, our colleagues at Occupational Health and Safety are leading the charge on this investigation, they will have more information as their investigation proceeds. You've heard us say here that the health and safety of the residents of Toronto, that includes members of the community as well as those who work here at the city in all the many divisions of the city, that's our top priority. I know that our colleagues through Occupational Health and Safety and her leading this investigation are very much seized of that, and we'll look forward to hearing what they reveal and what they find through their investigation.
Thank you.
Okay, everybody. I do apologize. We clearly are having some technical issues today, and we are trying to unmute some of you who have questions. Unfortunately, we're unable to do that. So if you have specific questions you want to send me directly, I will absolutely get you answers. I do apologize, and thank you for your patience. We'll get this fixed for tomorrow. For now, that will conclude today's briefing. Thank you.